Hello and good day, Miss Pravina. My name is Fiesta Stone Anak Bosher. Matric numbers BNURO 24046034. So today I will present my assignment under the subject Policy and Quality Management in Healthcare. So my topic is Role of Nurses in Patient Care. So let's start with learning objective. Number one is to understand the role and responsibilities of nurses in providing holistic patient care. Number two, to explain the importance of quality management concepts such as total quality management, TQM, and Donavidian models in nursing practice. Number three, to identify how nurses contribute to patient safety, healthcare quality, and positive patient outcomes. Number four is to discuss the importance of ethics, communications, and patient advocacy in nursing care. And lastly is to analyze the challenges faced by nurses and suggest improvement to enhance the quality of patient care. For the introduction, nursing is the heart of the healthcare system. It is a profession that combines scientific knowledge with compassionate clinical practice to ensure patient safety and recovery. In the context of healthcare policy, the role of nurse is defined as being a primary caregiver who manages the daily health needs of patient. This is by Pahara 2022. Patient care refers to the service provided to patient to maintain or improve their health condition by World Health Organization 2025. It is include assessment, planning, implementation, evaluation, communication, and emotional support. Nurses are responsible for ensuring that patients receive safe, effective, and holistic care. In hospital, nurses spend more time with patients compared to the other healthcare professionals. Therefore, their role directly affects patient outcome, recovery, and quality of life. According to Flaubert 2021, nurses act as a bridge between the patient, the family, and the medical team. They are responsible for monitoring patient progress, giving medication, and preventing medical errors. Without effective nursing care, the quality of healthcare would decline and patient risk would increase significantly. In modern healthcare, nurses are expected to practice evidence-based care, follow ethical standards, and work collaboratively with other healthcare professionals. They also help reduce medical errors, improve patient safety, and promote healthcare quality. Under the topic discussion, I will talk about what theory and model being used, and also I will talk about ethic in nursing. Firstly, to understand the role of nurses, we must look at a key quality management concept and theories that guide the profession. First is total quality management, TQM, and quality indicators. Quality management theories such as TQM are relevant in nursing care. According to Alzobi, 2019, in healthcare, TQM is used to ensure every process is aimed at improving patient outcome. TQM focus on continued improvement, teamwork, patient satisfaction, and reducing errors. Nurses contribute to healthcare quality improvement by following clinical guidelines, participating in audit, report incident, and improving patient care process. Nurses use nursing sensitive indicator (NSIS) to measure the quality of their care. This is by Gormley, 2024. This indicator include the rate of patient falls, the development of pressure sore, and the number of healthcare-associated infections. By tracking this data point, nurses can identify where care is failing and implement changes to protect the patient. Next is the Donner models. This is a classic theory that been used by nursing. Donner models consist of three parts. First is the structure or the setting. This is the resource and environment in which care is delivered. For example, physical facilities, equipment and technology, nursing staff, the number, skill and education, policies and procedures, organizations, structure, and also budget and resources. Next one is the process, what is done, the actual delivery of care and services to patient, for example, assessment, diagnosis, care planning, implementation of care, patient education, communication, and also documentation. And the last part is the outcome or the end result, the effect of care on healthcare status of patient and populations. For example, patient satisfaction, improvement in health status, complications and readmission rate, quality of life, mortality rate, and cost effectiveness. So the outcome influence structure and process for the continuous improvement. In nursing, ethics is a vital part of patient care. Nurses follow principles like beneficence and non-maleficence. Beneficence is doing good and non-maleficence is doing no harm. In daily practice, this means advocating for a patient right and ensuring they understand their treatment plan. Nurses follow virtue ethics, which suggests that being a good nurse requires character traits like honesty, courage, and empathy. This is by New Holmes 2025. Application to nursing practice. So under this subtopic, I will talk about theoretical framework, role of nurses, the example from hospital and clinical placement, and also the impact on quality management. So the theoretical framework of quality and policy management are not just academic concepts. They are the daily blueprint for nursing action. This is by Pagnucci, 2024. In a real clinical setting, the application of role of nurses in patient care translates into active safety management, interdisciplinary coordination, and personalized advocacy. This is by Petrosian, 2022. In a hospital, the policy on patient care applied through standard operating procedure (SOP). For example, when a nurse enters a ward, the application of quality management begins with the environment. This includes ensuring that resuscitation trolleys are checked, bedside rails are functional, and hand hygiene stations are stocked. In the clinical setting, care is applied through clinical pathway. These are structured multidisciplinary care plan which detail essential steps in the care of patients with a specific clinical problems. Nurses apply this by ensuring that every intervention from blood draw to physical therapy happen within the time frame by hospital policy to optimize recovery and minimize the length of stay, which is a key quality indicator for hospital efficiency. So, what is the role of nurses? The role of nurses in patient care involve many responsibilities that focus on meeting the physical, psychological, social, and emotional needs of patient. Nurses provide holistic care because patients require more than medical treatment alone. Holistic nursing care means caring for the whole person rather than only treating the disease. One important role of nurses is patient assessment. Assessment is the first step in the nursing process. Nursing collect information about the patient health condition through observation, physical examination, interview, and reviewing medical record. Accurate assessment help nurses identify patient problems and plan appropriate care. Another important role is planning patient care. After assessment, nurses develop nursing care plan based on their patient condition and need. Care planning helps organize nursing's intervention and ensure continuity of care. Nurses must prioritize patient problem and set achievable goal. Next is implementation of nursing care is another major responsibility. Nurses carry out nursing intervention to help patient recover and maintain health. These interventions include administering medication, wound care, monitoring vital signs, assisting with daily activity, preventing infection, and also responding to the emergencies. Next is medication administration is a critical nursing responsibility because medication error can harm patient. Nurses must follow the 7 rights of medication administration, which include the right patient, right medication, right dose, right route, right time, right documentation, and also right to refuse. Communication is also an important role of nurses in patient care. Effective communication helps nurses build trust with patients and families. Nurses explain treatment, provide emotional support, answer questions, and encourage patient participant in care decision. Patient education is another important nursing responsibility. Nursing educate patients about disease management, medication use, healthy lifestyle practice, and follow-up care. Health education help patients understand their condition and promote self-care. Nurses also play an important role in maintaining patient safety. Patient safety refers to preventing harm during healthcare delivery. Nurses monitor patients closely to identify early signs of deterioration and take immediate action when necessary. So another important role of nurses is emotional and psychological support. Many patients experience anxiety, stress, fear, or depression during illness. Nurses provide reassurance, empathy, and emotional support to help patients cope with their condition. This is the example from hospital and clinical placement. Example 1. Fall prevention and risk assessment. In a geriatric ward, nurses apply the Morse fall scale or a similar risk assessment tool upon admission. If a patient is identified as a high risk, the nurse implements a specific care plan, placing the bed in the lowest position and ensuring the call bell is within reach. This is a direct application of risk management policy intended to prevent injury and prolong hospitalization. Example 2 is pressure injury prevention. For bedbound patients, nurses apply the Braden scale to assess skin integrity. The nurse role is to implement a turning schedule every 2 hours and use pressure relieving device or ripple mattress. In clinical placement, seeing a patient remain free of skin breakdown despite being immobilized for weeks is a powerful example of how nursing process leads to a positive outcome. The impact on quality management. This clinical application proves that nurses are the primary driver of clinical governance. By documenting this action accurately in the patient progress note, nurses provide the evidence required for hospital audit. For example, in a ward records 0 fall in a month, It is the direct result of nurses consistently applying fall prevention policies. This data is then used by the hospital management to prove that the structure and process of the ward are meeting national quality standards. Critical analysis. Under this subtopic, I will talk about issue and challenges, suggested improvement, and also my personal insight. So we start with issue and challenges. The most significant problem is the global nursing shortage. When a nurse is assigned to many patients, the quality of care drop. This is according to Natsupawat 2021. This lead to missed nursing care, where tasks like repositioning patient or providing emotional support are skipped because there is simply no time. So the another issue is burnout. According to Kamisa 2022, high stress and long hours can lead to physical and mental exhaustion, which increase the risk of clinical error. Next is suggested improvement. To improve patient care, hospitals should focus on first, better staffing ratio. This is to ensure that each nurse has a manageable number of patients is the most effective way to improve safety. Number two is the use of technology. Implementing electronic health record (EHR) can reduce the time nurses spend on paperwork and allowing them more time at the bedside with patients. Lastly is supportive leadership. Nurse manager should create a just culture where staff feel safe reporting error without fear or unfair punishment. This is according to Kuma 2025. This allows the whole team to learn from mistake. The last point from critical analysis is my personal insight. So, from my perspective, nursing is not just about following a doctor's orders. It is about clinical judgment. A nurse must have the confidence to question a dosage if it seems wrong or to advocate for a patient who is unable to speak for themselves. The future of healthcare depends on empowering nurses to lead quality improvement projects within their ward. So, we have come to the last part of my presentation, which is the conclusion. In conclusion, nurses play an important role in patient care and healthcare quality. They provide holistic care through assessment, planning, implementation, education, communication, emotional support, and also patient advocacy. Nurses contribute significantly to patient safety, recovery, and satisfaction. The role of nurses can be seen clearly in hospital, emergency departments, intensive care unit, and community healthcare setting. Nurses are responsible for monitoring patient, preventing complication, educating patient, and coordinating care with other healthcare professionals. Despite their important contribution, nurses face several challenges such as a staff shortage and burnout. Healthcare organizations should support nurses through adequate staffing, training, teamwork, and supportive work environment. So overall, nurses are the backbone of the healthcare system. High quality nursing care improve patient outcome, strengthen healthcare service, and promote patient well-being. Therefore, continuous effort should be made to support nurses and improve nursing practice in order to provide safe, effective, and compassionate patient care. This is my references. I have 12 in total of reference in order to finish my assignment. That's all from me. Thank you.